my colleague and fellow Texan, Mr. Chip Roy, for 5 minutes.
Thank the chairman. I thank the chairman for holding this hearing. It's good to see the director. I want to echo what the chairman said earlier, that anytime I reach out to the director or the office at CBO, they're always responsive. I appreciate that. And it is a complex job and difficult, and I get it. This is an oversight hearing. It's not supposed to be a political stump hearing about various policies, but yet, as politicians do, we've gone down that road. I would, along those lines, try to at least blend the concept of oversight to address a few of the allegations being made by my colleagues on the other side of the aisle. And I just wonder, when we're talking about the subsidies that have been a part of virtually every one of my colleagues on the other side of the aisle's commentary, the subsidies that were expressly adopted by my colleagues on the other side of the aisle unilaterally during the Biden administration as COVID-era credits, that my question for you is would it have been possible for CBO to have made any forecast whatsoever involving those subsidies in, say, 2019?
No, I mean, we didn't have those in the baseline. We had the law as enacted by President Obama and not the subsidies.
Which did not include said subsidies because they did not exist, correct? Now my colleagues on the other side of the aisle are suggesting that these subsidies that were adopted by their own rhetoric as temporary subsidies and voted as temporary relief for a short period of time. Question, were they done so for 10 years?
No, the baseline followed current law, which was 2 years and then extended another 2 years.
For the subsidies, they were 2 years and then extended, right? So my colleagues on the other side of the aisle that passed these by their vote alone could not do them for 10 years, could not do them for beyond 2 years. And so here we sit, and now we're being told we must adopt these subsidies that were not even a part of your analysis because they were supposed to be temporary. And so my question for you is, as you're looking forward in terms of the baseline and going forward, is do you think that these subsidies are materially going to impact the bottom line of any American taxpayers, or will they more likely affect the bottom line of insurance companies that get literally 85% of their revenue from the federal government?
No, I understand the question. We haven't done that exact analysis, but it'll have those effects because people will, lose coverage, will have less subsidies. The tax credit, the mechanism is that the money goes directly to the insurance company, and so that'll have an effect on the insurance company.
So that's an important point here. The money that's being talked about goes directly to the insurance company, which is then supposedly supposed to materialize in some manifest benefit for taxpayers. So here's another question. Since 2010, since the advent of Obamacare, as it's called, or the Affordable Care Act, or as the Washington Post referred to it recently as the Unaffordable Care Act, in essence, has not healthcare as a percentage of the budget grown from something in the zip code, all in, Medicare, Medicaid, ACA, VA, all health-related, grown from something like 17, 18% in 2010 to 29 to 30% today?
No, that's right. And it's something that we're thinking a lot about, is what more information we can provide you on options to change the shape of spending with healthcare.
So this is going to bring me to my question that is now back to the oversight question, a little less of the political policy question in our limited 5 minutes. I'd like to do this for 30 minutes or an hour because it's the only way we can actually get to some result. You and I have talked before about this problem between CBO and JCT and the difficulty of the questions before us to make legitimate policy decisions on these complex issues. The one in particular, the question that bugs me the most, is if we were to transform our system so that we were no longer acting under the legacy of the wage control environment in which corporations get the tax benefit in a post-World War II environment for providing health care to individuals, but rather for giving those dollars as a expense in their, business to individuals to put into a health savings account. That if we did that and then transform the system to empower individuals with those same tax dollars, they're the same. You give them to individuals and allow them to then go shop in a market and then reinstate some competition and some regulatory flexibility for people in the insurance markets, that we could drive prices down and in fact have a positive impact on the budget. But yet we end up in an infinite do loop between CBO and JCT, sort of sticking finger in the air without an ability for us to make a decision that we think tomorrow, if we flip that switch, would make healthcare dramatically more affordable for the American people. How do we solve that problem?
Okay. No, it's an important question. It's something we've made some progress on. I'd like to do much more. It's such a big picture question. You're right. We would work together with JCT on that. And I would put that into the bucket, not a bucket, into the category of big changes that we would want to do, in some sense, a major effort on to understand the literature, to understand what we don't know, and work with you to get that done.
Well, thank the director. I'm out of time, so I'd yield back. I just think this is an important issue we should explore about how to address this issue.
Would the gentleman yield the time he doesn't have? Generously yield.
I will generously take time from the ranking member.
Just to follow up on this, because I mean, it is maybe a little bit out of purview of CBO, but kind of those